All right, well, I think we'll go ahead and get started now. Welcome to our second seminar in our Behavioral Health and Tobacco Dependence Treatment Seminar Series. We're so glad to have everyone with us today. I am Emily Koyagi, and I'm the Program Manager for the University of Kentucky's Behavioral Health Wellness Environments for Living and Learning, otherwise known as BeWell. We are excited to have the opportunity today to hear from Dr. Janet Otachi. She will be presenting comprehensive tobacco-free policy implementation, special considerations for behavioral health facilities. So we're really looking forward to hearing from her. Before we get started, I'll just mention a few housekeeping items. We are recording this seminar and it will be posted to our website. So if after the seminar is over, you have some colleagues that you would like to share it with or just want to have a copy to hear things again, we'll have that up on our website. Also, during our time together today, please feel free to use the chat. We would love to hear from you. You can also do a virtual hand raise. We really want it to be a comfortable, interactive seminar, so please participate. We would love to hear from you. One of the things we like to suggest as you're listening, if you could jot down 3 things. 1 is your main takeaway. 2 is something frustrating or challenging that you've heard about today in the seminar, something that you've faced while you've been working toward tobacco-free behavioral health environments. So that you can jot down something that's you've had some frustrating or challenging experience with. And then the last item is something positive that you've heard today or something positive that you've experienced in this work. So today our seminar will be divided into 2 parts. We'll have a 30-minute presentation from Dr. Otachi, and then we'll have 30 minutes for discussion and Q&A. So please feel free to share your thoughts with us when that time opens. And I think that's all I have for today. So Dr. Otachi, if you want to get started, share your screen. Thank you.
Thank you so much. You all are welcome. Thank you for your time and for joining us here today. My name is Janet Otachi. I'm a social work researcher who is passionate about influencing policies and evidence-based practice interventions related to substance use and addiction treatment and mental health. So in today's seminar, we'll be discussing implementation of a comprehensive tobacco-free policy in behavioral health settings. So thank you. We really appreciate you for joining us today. So our learning objectives we'll be discussing tobacco use among people living with mental and behavioral health challenges. And then we'll examine the best practices in tobacco treatment and policy implementation. And lastly, we'll be examining the different components and activities involved in implementing a comprehensive tobacco-free policy. So we'll begin this seminar discussion by just reviewing a few facts about tobacco use among people living with mental and behavioral health challenges. So according to evidence, we see that when you compare to the US general population, people living with mental and behavioral health illnesses or challenges, they use tobacco products at higher rates. And here we see it's up to 2 to 3 times higher than the general population. We also see that in addition to that, they consume more tobacco products, up to 41% of all tobacco products. And then when you look at the different psychiatric diagnosis, rates can even be higher when you compare to the different diagnoses. For example, according to evidence, this ranges from 40% to 90%. For example, people who have have been diagnosed with schizophrenia. It's been shown that their rates are as high as 90%. So in looking at the effects of tobacco use on mental health, we can see that people living with mental and behavioral health challenges and use tobacco products, they experience negative effects from tobacco use. For example, they experience high rates of psychiatric symptom burden. They're at high risk of being hospitalized. and then they require a higher dosage of medication to achieve the same treatment effect. So therefore, what we see here is that tobacco use affects their mental health care and recovery process. So when we look at tobacco use among people who have substance use disorders and addiction, we see that among people who use alcohol, they are 3 times more likely to use tobacco products. In addition, evidence suggests that people who use tobacco products are likely to start using, initiate use of other substances. So also based on evidence, it's been shown that when providers address tobacco cessation among people who use substances, they're likely to increase abstinence from other substances by 25%. So this shows the importance of incorporating tobacco treatment when we are addressing substance use or addiction among the populations that we serve. So in this next section, we'll examine best practices in tobacco treatment and tobacco policy implementation in behavioral health settings. So we see here that we do have clinical practice guidelines that encourage us to engage all people in tobacco treatment, including the clients that we serve or the patients that we serve that live with various mental and behavioral health challenges. And according to CDC, they recommend for mental health and behavioral health settings to stop practices that encourage tobacco use within these settings. For example, using tobacco as an incentive. And in addition, we see that we do have CMS quality reporting measures for inpatient psychiatric settings. They encourage for people in inpatient settings to screen for tobacco use and provide cessation counseling and FDA-approved medications. So how do we address tobacco in our agencies? Where do we start? This is a question that maybe we're asking ourselves. So we will look at a few factors. We'll begin by phase 1. The first thing that you need to ask yourself is, are we ready to adopt a tobacco treatment policy? So when you're assessing your readiness to adopt a tobacco treatment policy in your agency, it's important to ask yourself, are we ready to adopt this policy? And then after asking ourselves whether we are ready, we need to assess what is currently being done in our agencies. What are we doing? For example, do we have a tobacco treatment policy? And do we offer our clients evidence-based tobacco treatment services? And if we do, what are these services that we offer our clients? And lastly, do we have systems in place to facilitate referrals? If you're an inpatient setting and you want to continue treating a client or a patient post-discharge, do you have those systems in place to facilitate referral to Quitline, for example? So the next thing that we need to consider is the change process within the agency. So some of the key questions to ask ourselves and reflect upon might include whether your agency desires to change. I've talked about that before in our previous slide. Do you want to implement the tobacco treatment policy? And what do you need to change as an agency? For example, do you have fewer providers who are engaging clients in tobacco treatment or engaging patients in tobacco treatment? Do you have providers that are trained in evidence-based tobacco treatment provision or delivery of evidence-based tobacco treatment services? And what resources do we have? Do we have the FDA? Do we have access to the FDA-approved medications? Do we have funding to facilitate this policy change? Do we have, we know that BHL has been a very good resource, and with partnership with KDPH and Medicaid, they've been doing training for behavioral health specialists. So just a question that we ask ourselves in our agencies, do we have certified tobacco treatment specialists? And then I don't know if we are all familiar with the stages of change theory. This is the trans-theoretical model. So I'll use this to just revisit and look through our organization's change process. So This model introduces us to the change process, and it occurs in 5 stages. So we will use this model to explore just the change processes and our readiness to change within the agency. So when you look at the stage 1 here, that's the pre-contemplation stage. At this stage, the agency may not be aware of the disparity that exists. Maybe it's something that is somebody has heard about, but they don't know about the statistics or the burden of the disparity that exists in tobacco use among people living with mental and behavioral health challenges. Or the agency may not be aware that implementing a tobacco-free policy or a tobacco treatment policy may help address this disparity. So lack of awareness may be the reason why the agency does not want to change or is not ready for change. Stage 2 is the contemplation stage. In this stage is where we are starting to think about implementing a tobacco treatment policy, and we're having these deeper discussions about this change. And in stage 3, it's the preparation stage. We are motivating our agencies, the staff, the management to get ready about implementing a tobacco-free policy or a tobacco treatment policy. And in stage 4, this is the action stage where we are actually implementing the policy. And in stage 5, this is maintenance, where it's become sustainable within our agencies and it's become part of our organizational practice and behaviors. So we'll now take a deep dive into discussing these different stages in relation to organizational change and identifying key issues that we need to take into consideration. So by you being here today, it suggests that you're aware that tobacco use is an issue among the clients or the population that we serve, people living with mental and behavioral health challenges. It also suggests that you may be interested in implementing a tobacco treatment policy or a tobacco-free policy within your agency. So we talked about asking ourselves whether our agency is ready for change. If your agency is unaware, I just highlighted that in our previous slide, you'll need to provide information. It's important to talk about tobacco use, its negative effects among the people that we serve, beneficiaries, and also you may share in this stage, you may share testimonials from people living with mental illnesses or behavioral health challenges, and they've quit successfully and they're living a healthy life. So in stage 2, we'll revisit the consensus building or contemplation. In this stage, you want to be clear the reason that why you're addressing tobacco in your agency. It may be due to the evidence that we discussed earlier regarding tobacco burden that our clients face or the patients that we serve face. And more so, it may be due to tobacco compromising their recovery. So in this stage, you want to establish a tobacco-free work group. It's important to, at least if we have different disciplines represented, different departments, it's important to ensure that you have all these departments represented, and also make sure that everybody's on board, management, the staff, clients, or patients. Begin having these conversations and have a clear vision for implementing your tobacco-free policy. And listen to the staff, listen to the concerns that management is having or clients. And then it's an opportunity also to provide education and training just to address these concerns or issues and to develop resources that you use for continuous training as you implement the tobacco-free policy. So in this next stage, we'll talk about motivation or preparation. So you want to motivate your agency to adopt tobacco-free policy. So an important thing here to start with developing the tobacco-free policy and an implementation plan. You need to have that policy in place. And it's important, just as we talked about earlier or in a previous slide, that it's important to gather as much input from various stakeholders, from your providers, from your patients, from the management, and also ensure that the policy that you design is comprehensive. We'll discuss what we mean by comprehensive in our next slide. So lastly, it's important to plan for the implementation process. So develop, gather information, design the policy, and plan for implementation. So here I'll introduce you to what a comprehensive tobacco-free policy looks like. So in designing a comprehensive tobacco-free policy, we should consider the policy itself. What products are we covering in the policy? It's important to consider all tobacco products, including e-cigarettes or vapes. And also the policy should address what activities are we restricting? Are we restricting, we say smoke-free policy or tobacco-free policy. So within our campuses, we're not, it's restricted to use tobacco products within the campus. And also the policy also should highlight what people are being covered in the policy. Are you covering employees, the clients, the patients, the vendors, volunteers, every person who's within the organization? These are important things to take into consideration. And the second thing you should consider or incorporate is to ensure that the policy is supportive. You don't want to also stress your staff. So for example, consider providing, you're taking into consideration providing information or educational materials to your staff, and also the timing, the time factor as a resource. How are you going to utilize the staff that you already have? So it's important to take that into consideration as well. And the policy should also consider your clients or the patients, and what services are you providing for the patients? Do you have referrals set up? Referral systems in place? Do you have follow-up systems in place? And lastly, you should consider the community. You want to build these partnerships and to continue strengthening this relationship so that there'll not be gaps when you're seeing the client. Is it, even if it's within an outpatient or inpatient setting, is that care, are you taking into consideration the continuity of care? It's important that we look at these things and take all these things like the policy, the staff, the clients and the patients, and the community when we are designing our tobacco-free policy. So we look at motivation, and the motivation, we want to establish a plan for implementing our tobacco-free policy, and things to consider include doing a needs assessment to determine where do we begin from. In this stage, you also identify what resources that you have and what needs that you have and what services you will offer. And it will also just guide from the needs assessment, this will guide the implementation plan. And finally, how you are going to enforce the policy to ensure that people are adhering to this policy. So we'll now examine key things to consider when planning for change. We'll need to develop a logic model. You'll need to establish a timeline for implementing and also have a budget. So what is a logic model? I'll just go through all these three things, the three things that I mentioned that you need to consider. So a logic model is a visual way of presenting how the resources that you have will tie into the outcomes that you desire. How do they interconnect? And it helps to identify gaps, and also it's more of a strength-based approach to implementing, because you're looking at the assets that you have. You're looking at what are the resources that you have right now that will help you. You're not looking at the, as much as there is gaps, but you're looking at, it's a strength-based model in the sense that you're looking at the resources that you currently have within the agency that you're going to use to achieve the outcomes that you've planned to achieve. So I don't know if this is clear. Can you all see? This is a logic model. It's a sample logic model. And on the left of the model, you have situation or needs. Like you look at the situation, this is like the needs assessment part and your initial planning for implementing this policy. So you're looking at what is the situation? Do you have the policy in place? Do you have resources in place? And then you look at the inputs, the things that you'll invest to achieve the change that you desire. This could be staff, it could be funding, it could be cessation medications that are FDA approved. And also you have outputs, which includes what activities do you want to do to be able to achieve whatever you're planning to achieve with this policy. So it could be you want to train staff, you want to engage more clients, you have in tobacco cessation, you want to provide more FDA-approved medications, you want to provide counseling, you want to strengthen the referral process or follow-up. So these are key things that you're looking at. And activities may also, or I've talked about that, it may include screening for tobacco, educating our providers, and providing that referral for follow-up. And when you see here, we have our outcomes can be short-term and they can be long-term. So for short-term outcomes, you're looking at for the different departments or settings that you have represented, how many staff have you reached? You've trained maybe 40 staff this month. You've had 5 specialists, 5 staff who are tobacco treatment specialists who've been trained in tobacco treatment specialists. So those are the key outcomes that you're looking at. And then overall, you're looking at the long-term impact of this policy on our patients. Are they living healthier lifestyles? Have they reduced? Is the prevalence of tobacco use reducing within the clients that we, among the clients or the patients that we serve? So have we incorporated the tobacco treatment policy within the culture and the practices of our agencies? So these are more like long-term impacts. So we talked about also the importance of considering having a timeline. In this slide, we have a sample timeline, and the timeline just shows the planned activities that you have and your anticipated completion date. Maybe you want to raise awareness to the staff, you want to begin in February, you want to complete in May. You just take into consideration all these activities and plan how you want to achieve, like how do you want to lay them out. And then important things to consider when it comes to your timelines is whether you want to launch the policy. For example, we just had the Valentine's Day. Maybe if you're planning, do you want to launch to go tobacco free on Valentine's Day? Do you want to go on Independence Day? Pick a day that has a meaning to Americans or the community. And also consider the amount of time that you have. Earlier, when we were talking about looking at the situation analysis, assessing the needs and all that, if you see that your clients are not the staff are not aware, or they're not ready for change. So you're looking at, do we need 9 months to implement this? If they're more like receptive of this change, you're thinking, do we take 6 months to, you look at all the needs and the situation at hand, and that will also determine the timeline considerations. So this is a sample budget, just to show you, you can look at the communication aspect. You want to develop educational materials, you're looking at the environment, you want to put smoke-free signs if they're not there. You're looking at the policy management, you want to train the staff, and also you look at the tobacco treatment, like the services that you want to produce, the services that you want to deliver. So you're looking, for example, do you want to offer FDA-approved medications? Do you have a budget for that? These are things that you need to consider when you look at the budget. And now we'll move to, we'll discuss the policy and tobacco treatment services implementation. This is our phase 2. Our 4th stage of change, we talked about taking action. So this is where you implement the tobacco-free policy and treatment services within your agency. So we highlighted the importance, and I'll just revisit it here, of discussing that with different stakeholders and departments regarding this policy prior implementation. And it's important to just have that support from your stakeholders, from the different departments or different interest groups, different people that we are working with, to have that just community of support. I call them champions for change. And it's important to communicate about the policy changes. This is very critical. You'll continue having continuous discussions. And also in this stage, action stage, you begin offering treatment services. In addition, you'll encourage strategies for adherence, enforcing. And sometimes we look at enforcing as a negative thing, but it could be just providing information. I want us to focus more on educating the people who are being impacted or influenced by this policy. Continue providing information, continue training. And I'll just say educate. So continuous education is very important for sustainability of the policy. And then stage 5, it's maintenance. You want to have sustainability. So you want the policy and the treatment services to continue within our agencies. So in this stage, it's important to look at monitoring and implementation, just to check, are we adhering to the goals that we set to achieve? And you want to, that's what we call fidelity. The way we had planned to roll out this program, are we adhering to that? But it doesn't mean, sometimes there could be things that this is an opportunity for learning when you see there are gaps. So don't take it as a negative aspect. I want us to look at this as a strength-based approach, whereby when you identify gaps or things that we missed, we are building on that and addressing this just to continue enhancing the implementation process. It's a learning process. Evaluation should be somewhere where we are learning from this and it's influencing our management decision-making to be able to improve the lives of the clients and the patients that we serve. And then in this stage, you also, I've talked about that, address barriers. And then this informs future planning. And barriers should be, I'll just re-emphasize it, it's an opportunity for learning and for planning and re-strategizing. And then we've talked a lot about staff education. I just wanted to also reiterate the importance of continued staff training. Sometimes you have new staff joining. It's important to incorporate this in your when you're doing orientation, so that you ensure that you're sustaining this policy, you're continuing with this practice within your agency. So we touched on evaluation a lot. We looked at the model. We talked about that in our previous slide, and now we'll talk more about that in this phase, in phase 3. And our focus will be on evaluating outcomes for the policy and tobacco treatment services, the implementation process. So this is a model that has been used widely. When you look at implementing public health programs, this is the RE-AIM model. I don't know if you're familiar with this, but I'll just touch on it here. It's called, when you look at the different components, reach, effectiveness, adoption, implementation, and maintenance. That's why it's called RE-AIM. So this framework may guide the implementation. It can be, I just wanted to say it's a good framework to start. This is a good place to start at, because it's a simple, you're looking at these different 5 components to guide your implementation and monitoring implementation and evaluation. So when you're looking at the reach, you're looking at the participants, the people who've been beneficiaries from this policy that we're implementing. How many staff have we trained? We talked about that when we were looking at the logic model. How many clients have we reached? How many maybe settings? If we are a big agency and we have like 40 satellite settings, how many satellite sites have we reached? Have we reached with this policy? You're looking at all these things. And then effectiveness, you're looking at both the negative and positive impacts of tobacco-free policy, of implementing the tobacco-free policy. And again, I'll re-emphasize, this is just for learning. Whatever impacts, whether positive and negative, these are very important because they'll guide our decision-making about future implementation of this. And we learn what to adjust and what resources are more needed. So it really helps in management decision making. And then for effectiveness, you're looking at the outcome of the implementation. I've talked about that. So for adoption, you're looking at the different settings and departments that have been reached by this policy. And for implementation, you're looking at, we talked about fidelity and the objectives that we had set to achieve. Are we implementing the policy based on these objectives? How are we adhering to the tobacco-free policy? If it's all products, is it all products that are prohibited on site? You're looking at that. And then maintenance is just sustainability. And I would call that as just when I look at maintenance, I look at organizational culture. So this has become part of our practice, part of our culture. And when new staff over time, we know we're all speaking, we all have a common voice, and we are talking about tobacco-free policy. And so just as we wind up this discussion, I know I have like 2 minutes left, so 1 and a few seconds. What would be the biggest selling? These are some key questions to ask yourself and reflect upon, and maybe they'll guide our discussion. What's your selling point when you want to talk about a comprehensive tobacco-free policy or within your agency? What is the selling point? I know Emily had touched on this earlier in the introduction about some key things to reflect upon. Then we look at what resources do you already have in your agency to support this policy, and what outcomes do you anticipate from implementing a comprehensive tobacco-free policy. And what will be the most challenging part? I think, Emily, maybe we were in sync because you asked that question in the beginning. And then the last question that I would like to ask you as you leave here today, or as we go to the next part, and then the rest of the day, is on a scale of 0 to 10, how confident are you that you could help your organization to design, launch, and sustain a comprehensive tobacco-free policy? So I made it to the 30 minutes. So these are some of the resources that I used to develop the slides. I don't know, maybe Emily will share the slides after this. I don't know what the plan is. You'll let us know.
Yes, we can put the slides and the recording up on the website.
Okay, so now the next part is questions. I'll stop sharing and then I can take any questions. And we have a team of experts here who will chime in. Thank you.
Yes, I was going to say that as well. I know there are a lot of experts here on the call, so we really want everybody to, if you have an experience you've been through that you could help someone else with, please chime in. We're glad to hear from you.
Emily, I want to first ask, what is the website address for Be Well?
I will put that in the chat.
Okay. I know our problem here at Eastern State for staff is we're short-staffed, very much so, and staff work 12-hour shifts, so it's really hard for them to get that break, that cigarette break, and they have to go out to the car and drive across the bridge to do that. And it takes a lot longer than their 15-minute break. I guess I need to, staff want to be able to get nicotine replacement on site here.
Sorry, Dr. Cole, is that something that you can chime in?
Well, I know with Eastern State Hospital, it's a unique situation because it's managed by UK, University of Kentucky, and the staff at Eastern State Hospital have the same benefits that any University of Kentucky employee would have. And the University of Kentucky has employee benefits. So one of them is they do provide nicotine replacement therapy for any staff, faculty who would want to engage in tobacco treatment.
Yeah.
I think the challenge with Eastern State is we don't have those resources, particularly on site at the campus. And maybe that's something you champion. Go for it, Karen. Let's champion this.
Yeah, I have spoken to, who is it that is part or runs that program at UK?
Audrey Darnell?
Audrey. I have spoken to Audrey before, but I've just kind of dropped the ball because it looks like it would be possible for us to offer that on site, and then I would offer some counseling to each employee. So it's something that it looks like I really need to follow up with Audrey about to see if we could offer that here, and doing telephone counseling or something like that is not a problem. So I'm actually going to put this in red.
And for those on the call, Karen is at Eastern State Hospital. She's our tobacco treatment specialist there, and she addresses a lot of the needs that the patients have at Eastern State Hospital. But we're recognizing, since going tobacco-free in 2014, we're recognizing that the staff need additional resources. So great point. Thank you, Karen.
Yeah, thank you.
Do you have any other questions? Any other thoughts? Anything that you reflected upon?
I did. So I work for North Key, and we are already at least waist deep into tobacco-free reduction, moving things around, participating in things. I am part clinician, part not clinician. So from the not clinician side of things, I've heard about a lot of stuff, and of course, I'm here. And all of our clinicians were given access to this training, and all of them in this series. I'm wondering if there's any thoughts on kind of best practices to get our folks working in an outpatient setting bought into, like, it's a little bit awkward to talk with your client about their tobacco use, but you should do it, and here's here the facts are the facts, and we all know that. And I think you all do a really great job of like presenting us with the facts, and I've jotted some notes down, but like the tactfulness of this is how to start those conversations, if you had any advice on that.
I have seen, this is just an example, and feel free to chime in, Dr. Conley, or sorry, Karen. We've had little pamphlets about, just to encourage their educational pamphlets for the providers. They can put it on the desk or pocket size, where you can have like the 5 A's approach, ask, just in summary, or the 3 it's the 3 A's. So it's important to have those little educational pocket size resources for the providers. You can have them when you're trying to change a culture. It takes a lot of education, a lot of discussions. When you're having maybe orientation, put that in, factor that in. When you're having weekly meetings, keep on just championing for that change. And when you put like those flyers or pocket size pamphlets on a provider's desk, it can just summarize very in simple language, very simple steps. It's important to have you ask your clients about tobacco use. So incorporating such educational materials in the consulting room or therapy room, that's an important place to also start. Yeah, I don't know. Anyone else who has something to add? Remember, this is we're having conversations and we are all champions for change. So thank you.
I do have a follow-up to that.
Yeah.
In a, well, it probably doesn't matter what committee, in one of the many committees I attend, we discussed the kind of fine line and like the mindfulness that has come with tobacco use, tobacco use was widely accepted, and you asked to go to the smoking or non-smoking section at Frisch's, and now there's a lot of shame around it for some populations. And so walking into that conversation, I think a lot of people are a little bit apprehensive because everybody knows smoking statistically has all of these things that happen. The science has proven it. But for some people, they might say politically towing that line and coming across as non-judgmental. Similar conversations for like doctors and weight in the offices, and talking to people about how their weight affects their health, but also not shaming them and being very conscious of that. So I don't know if anybody has thoughts on that, but that's definitely something that I know has been like really present in a lot of our minds.
The only thing that I may add there is also addressing stigma. Just when you look at diabetes or somebody having a heart problem, when you have the physical illnesses, there's actually probably less stigma or no stigma at all as compared to addiction or substance use. So addressing the stigma around tobacco use is something also to consider in our educational, I think, conversations, education, having resources. For example, I talked about testimonials, like people who've gone through it. They're living, you can have peer facilitators, people who've gone through it. They're living with mental and behavioral health challenges. They've quit tobacco, and they can be champions also. They can be the ones who are providing this education as peers who've gone through this and they've achieved this recovery. They've stopped using, they've quit successfully. So that can show other people that, we can address, it's nothing to be ashamed about. It's something that if you address it, it leads us to our mental health, wellness, and recovery. So just addressing stigma and having those conversations. I don't know if somebody else has thoughts, something to add.
I can chime in a little bit. Taylor, thank you so much for the excellent comments. I'm also, a researcher, but I'm also a provider, and I see patients. And of course, given that I do a lot of tobacco control, I'm not really embarrassed talking to them about tobacco use because I know how much it harms their recovery. And I think it's first coming to that point of understanding, like any other substance of abuse, tobacco use is not innocuous. It does cause a lot of harm. And if you talk long enough with people, they will bring up those harms. So one of the tools we use is the decisional balance. I start by asking them, so what are some of the good things that you get from tobacco use? Because they absolutely have some positive reasons. But then you ask them, what are some of the not so good things that come from tobacco use? And you get those as well. So you're not necessarily stigmatizing or shaming, but you're helping them think through the behavior and how it's affecting them. And invariably, many of the patients I'll talk to, they start mentioning things about stress, about nicotine withdrawal, which becomes an opportunity for me to explain the relationship between tobacco use and their treatment, their psychiatric mental health treatment, many times how it actually is compromising their treatment. I had a patient recently who has PMDD, premenstrual dysphoric disorder. And there is a study that shows that people with PMDD and use tobacco have worsened symptoms, and she's a tobacco user. And just letting her know about that study and showing it to her was convincing enough. So she's coming back and we're going to work on tobacco cessation because she wants to feel healthier. She wants to be better. So the second thing I'd like to address is your first question. How do we convince us providers? One thing we did at Eastern State Hospital, which may be helpful for you, Taylor, would be we did a survey. We did a survey among all our providers and asked them the questions. What makes it difficult for you to engage patients in tobacco treatment? And we're very happy to share that survey if you think it would be interesting to use. And based on the results from that survey, it's a lot of what Dr. Otachi was speaking about. Then we created these resources, very specific for providers, because one thing they said is they just don't have confidence and they don't know how to begin addressing it. So we created resources within our clinic context that were relevant to our providers. Okay, so with data gathering, you get some information that can help you plan what to do for your specific context.
Yeah, thank you for that. I am all about data gathering. The number of Microsoft forms I have is ridiculous. So yeah, thank you for that. I definitely took a lot of good notes.
Do we have any other questions? You can just unmute and chime in or put it in the chat. Has anyone started this process and maybe wants to share some of the positive experiences you've had or some of the challenges? All right, well, if we don't have any more questions, we can go ahead and close for today, and I can follow up with everyone when we get the recording put on the website, and I'll send you guys the link so you can share it with your colleagues and save it for your own use. So it was really great to have everybody today, and we hope to see you at our next webinar, which will be on March 16th. So thank you guys again for being here, and thank you, Dr. Otachi, for a wonderful presentation.
Thank you all. I appreciate you.